So welcome to the town hall. Just a quick note, your phones will be muted during this presentation. If you have any questions, please submit those questions in the Q&A box, and we will address those questions during the Q&A session. I also want to note that we're not utilizing the chat feature, or we're not monitoring the chat feature, so please avoid using that. Also want to note that we are recording this slide deck as well as this presentation, and we will issue that to our tenant agencies. I want to go ahead and review our agenda for today's presentation. I will do the introductions of our panel. We will then do an overview of our water quality management strategy. We'll discuss why we're testing. A special pathogens laboratory will then review the Legionella basics. We will then go over corrective actions, and we'll go into a Q&A session. So let me introduce our panelists. We have Courtney Hatchell, Senior Advisor, Public Building Service, Office of Facilities Management. Brad Short, Program Manager with National Industrial Hygiene and Safety. I'm Michael Harvey. I'm a Supervisory Building Manager with Region 7, and I'm also helping lead the Program Management Office for Water Quality Management in Region 7. We have Jennifer Zinnick, Industrial Hygienist for General Services Administration, Region 7, Safety, Environmental, and Fire Branch. We have Dr. Stout, Janet Stout, with us, Infectious Disease Microbiologist with Special Pathogens Laboratory. And Dr. Abraham Cullum, Director of Water Safety and Management with Special Pathogens Laboratory. So let me go ahead and turn it over to Courtney.
Okay, thank you, Michael. As Michael said, my name is Courtney Hatchell, and I'm with GSA's Office of Facilities Management. And as the Senior Advisor, I am overseeing, I guess I consider myself kind of the ringleader for this water quality management effort that we've kicked off this fiscal year. So I'll start by talking a little bit about the water quality management strategy that we've put in play. Properly and next slide, please. Properly and proactively, I'm getting ahead of myself. Go back one slide. There we go. So maintaining a building's water system supports our building manager's efforts to reduce the presence of heavy metals, as well as conditions in which Legionella and other bacteria can grow. This is really important for large buildings, as well as our buildings that have unique features like decorative fountains or cooling towers or humidifiers. A program to manage water quality helps us understand where issues affecting that quality might occur and how we can fix any problems. So a proactive strategy, you're going to hear us say proactive a lot. A proactive strategy allows us to protect the safety of employees and customers. To that end, after consultation with federal, state, and local agencies, along with industry experts, two of which have joined us today, GSA updated its drinking water quality management order in November of 2023 to ensure that proactive measures are taken to help ensure the safety of our customers. Next slide, please. One of those measures is testing. Testing helps ensure that the water management program is working. So for example, you can get a baseline measurement like what we're doing at many of our owned and leased spaces this year, so that Legionella, which is naturally present in drinking water, can be checked over time. Even buildings that do a good job managing their water might detect Legionella. Maintaining good water quality can help ensure that small levels of Legionella aren't able to grow, spread, or get anyone sick. It's important to note that this testing effort was not done in response to any known deficiency or hazard in our water system. This is a proactive strategy to identify issues that might lead to those hazards. Next slide, please. Okay, so as Dr. Stout and Dr. Cullum will elaborate further in the presentation, detecting Legionella in water systems, even those that are well managed, is not unusual due to its naturally occurring presence. We estimate it's going to be found in approximately 50% of these facilities that we're testing as part of this effort. The baseline testing initiative, which covers approximately 1,300 of our GSA-owned facilities and 6,000 of our lease spaces, aims to implement strategies that might include increased flushing, further monitoring, for more Legionella sampling, adjustments of our operational parameters, etc., all to prevent the growth and spread of Legionella and help ensure it does not pose a health risk. In addition, this baseline testing will help us identify any antiquated water systems, faulty plumbing, or subpar cooling tower conditions. Finally, based on the results of this baseline testing, we'll develop a longer-term testing program and refurbishment schedule. Basically, the testing provides us with the data we need to make better water quality decisions. Again, while achieving zero Legionella is not feasible due to its natural prevalence, GSA is committed to implementing these industry standard water management practices with the goal of preventing cases of human disease. Now I'm going to turn it over to Brad, and he'll talk more in depth about why we are testing. Take it away, Brad.
Great. Thank you, Courtney. And I just want to extend my gratitude for everyone being here today and participating in this effort. You know, you guys are a big part of this, and we want to make sure that you guys have all the information that's necessary to make educated decisions about your health and safety as well. And we hope we can provide that context today. So at this point, I will continue the overview of GSA's water quality initiatives and kind of explain why we believe this is so critical. Following that, industry experts will guide us through a detailed informational session on Legionella. So let's start with why we're testing. Basically, our objective is clear, and Courtney kind of already touched on it, but I'm just going to reemphasize a few points that she laid out and then pass it over to the experts for more information. But basically, our goal is clear: to proactively identify potential issues and refine our water management practices to address those conditions that may foster the growth of bacteria or the release of metals. This process includes baseline testing for lead, copper, Legionella, and total coliforms, including E. coli. And testing is a key component, as Courtney outlined, ensuring the effectiveness of our water management practices and allowing us to develop maybe water management plans or different strategies from a preventative maintenance standpoint that we can implement in a lot of these facilities to better control some of that bacteria or some of those conditions that might lead to bacterial growth. And it allows us to make those operational adjustments with those PM schedules or different sort of maintenance activities. And this could be optimizing water movements, such as things as flushing. We could be looking at disinfectant levels. We could look at hot water delivery temperatures, or in some cases, even changing plumbing components. It's all kind of dependent on the results that we see and the very site-specific type responses. And while there's no mandatory requirement for water testing, we recognize the importance of this effort. And that's why GSA has been dedicating significant resources to this effort. And beyond addressing those operational concerns that we talked about, we aim to set a positive example and inspire other industries and property owners to adopt similar proactive health and safety measures. By championing this culture, GSA can promote better standards across various sectors, including the regulatory sector, which really doesn't have very much in terms of building owner water testing or regulatory limits. So we really hope to make meaningful changes in a lot of these different industries. Next slide, please. I think Courtney kind of stole a little my thunder with this one, but I'm going to go back for it and then we'll hand it over. So it is important to recognize that detecting Legionella in building water systems, even those that are well maintained, is not unusual. It's a naturally occurring bacteria that we're going to find in a lot of facilities. It'll be anticipated that we find this at about 50% of facilities, and even many of our homes today have these, as well as a variety of different other community exposure that we have, whether that's hotels, grocery stores, kind of all these different places that we interact with water sources. You know, a good portion of them might have Legionella bacteria in them. And so part of this proactive measure, we're trying to determine which facilities do have Legionella. It's not going to be found everywhere, but we want to be able to determine which of those facilities kind of fall in that 50% range. And that gives us the tools that we need to be able to take those next steps. And the reality of the situation is that Legionella bacteria has probably been there for a long time, maybe even since the building was constructed. So it's not anything potentially new, but we just want to make sure we get a better handle on it and implement industry standard practices to control it. So at this point, I am going to hand it over to Dr. Stout to continue on the conversation.
Thank you very much, Brad, and thank you all for being with us. I'm Dr. Janet Stout. I am an infectious disease microbiologist, but more importantly, I think for you is that I've spent my entire career, which now spans over 40 years. I'm always shocked to say that, studying Legionella. And what that means is that we've done our own scientific investigations. I can tell you about lots of other scientific investigations. And so the information that I share with you today is what we say in medicine, evidence-based or data-driven. It's not my opinion, it's based on the science of Legionella. And so my goal today is to share that knowledge with you and to tell you that I understand that it's unnerving to find out that Legionella is in your water, especially if you don't have a lot of information or education around what to expect about this bacteria in our water. So that's the purpose of my comments and discussion today. Next slide, please. So the first thing that I always want to make sure we have a common understanding about is, well, what is Legionnaire's disease? It's pneumonia. It's not bronchitis. It's not a cold. It's pneumonia caused by the bacteria Legionella. And so the reason I emphasize that is, sometimes people get a respiratory infection, like a cold, and they think, oh, it's Legionnaire's disease, but it's not. A medical person has to listen to your lungs or do a chest x-ray to confirm that you have pneumonia, and then do a very specific diagnostic test to show that it's actually pneumonia caused by Legionella bacteria. Most common test is one done on urine, and you can also culture the bacteria from sputum from the lung. So Legionnaire's disease is pneumonia. There's a very large family of these Legionella bacteria. Back in 1976 at the Bellevue Stratford Hotel, very first outbreak of Legionnaire's disease of the American Legion, there was one member of the family, Legionella pneumophila serogroup 1. And now there's over 60 members of the family. Only about half have been associated with human disease. And even to this day, that one original member, Legionella pneumophila serogroup 1, causes the majority of infections. And so that's the one that we really pay attention to. And, we were talking about testing. The purpose of testing really is to establish, is the building housing Legionella or not? And we'll get into some more details about this because Legionella is not everywhere. So it's important to ask this question by doing testing. And as Courtney said, we're going to say proactive several times. And I've been an advocate for proactive prevention of Legionella infections all my career. And so I'm very happy that GSA is being proactive in managing this presence or potential presence of Legionella in our water systems. And I want to put into context what risk really means. So next slide, please. So Legionnaire's disease as a pneumonia out in the community it causes very few infections, actually. And this is based on studies we and others have done. In the million or so cases of pneumonia that occur each year, only 2 to 5% of those are caused by Legionella. So the infection itself is quite rare. When it does happen, who gets Legionnaire's disease typically? And it's typically people that have these, are older, smoking. I always say if there's one more reason to quit smoking, it's Legionnaire's disease. So being older, greater than 50, smoker, and then having conditions that make our immune system less robust, less able to fight off infection. And of course, the most extreme example of that is a transplant patient. They receive medication to suppress their immune system. And then people that have chronic lung disease, they receive high-dose corticosteroids. That's also a suppressant of the immune system. And then conditions like diabetes and, of course, cancer, because people are getting cancer chemotherapy. So when the disease occurs, that small percentage, who gets Legionnaire's disease? Typically, it's people that have these conditions. Next slide. So again, we said 77% are older, greater than 50. Interestingly, this has been true since the beginning. Mostly men, or the majority of infections are in men. Don't really know why that is. And then when this infection does occur, this form of pneumonia, many of these people become hospitalized. And oftentimes it's because there's a delay in seeking medical attention and a delay in getting appropriate antibiotic therapy. And so this is one of the pearls or the learnings is if anybody gets pneumonia, tell them to say to the doctor, I want you to test me for Legionella, even in the rare instance it might be Legionella, so that I get on the right antibiotic. And so that's one pearl from the lecture today. Next slide, please. So this is the reason, this slide is the reason why only 2 to 5% of the pneumonias in the community are Legionella. These three factors have to come together in just the right way and just the right timing in order for disease to occur. So first factor is the disease-causing type of Legionella needs to be in our water. And we talked about Legionella pneumophilus serogroup 1 being the most common. And then it has to get into our lungs. And so, Legionella can be in a puddle of water on the ground, but it can't get into our lungs, so that's not a problem. And then finally, the last factor, and probably the most important factor, is that once it gets into the lungs, is it the lungs of someone who is compromised, a susceptible individual? And so these three factors rarely come together in just the right way and just the right time for disease to occur. So again, part of my desire today is to put into perspective what it means to have Legionella in our water and how relatively rare it is for anyone to become ill with this infection. Next slide. So I'm going to take you a little bit on a journey, and this is the journey of Legionella bacteria from our natural water sources through our municipal water treatment and into our buildings. And so going from left to right, very early in the study of Legionella, we could determine that Legionella bacteria were in really small numbers in natural sources of water like rivers and lakes. That water goes to the treatment plant, and the typical chemistry is chlorine to kill bacteria that can cause large outbreaks of usually diarrheal diseases. Well, Legionella is more tolerant to the amounts of chlorine that are used typically at our municipal treatment plants. And so small amounts go into the distribution system, that miles and miles of cold water in pipes that go throughout our cities. And when studies are done on whether or not Legionella is in that water, again, it's very, very low numbers. Maybe about 2 to 3% of that water might have some kind of Legionella in it. And so when we test the water coming into the building, that cold water, oftentimes we don't find it. It's in undetectable numbers, but we know it's coming in. Well, it's the conditions within our buildings. If you could click one more time for me. It's the conditions within our buildings that help, if Legionella is there, may help it to grow. And one of the more important factors is the warm water distribution system. So that means the recirculating hot water. The hot water is oftentimes, but because of code regulations, sort of in the sweet spot of Legionella to grow. And then all those pipes and miles of pipes and nooks and crannies and sediment and things in our building water systems, if Legionella is there, it can grow. And Legionella is not the only bacteria that's growing in our water systems, but that's a discussion for another day. Next slide, please. So one of the things that people used to always say to me is Legionella is only in old buildings. And so I just wanted to talk to you about new construction. So we asked the question, is that really true? And there was a brand new hospital being built here in Pittsburgh as part of the VA Medical Center, which I was part of for 23 years. And we asked the question, how long would it take Legionella to show up in a brand new building? So I was there when the very first faucet sink was installed. Do you think Legionella was there? Yes, it was there right away. So we know that many buildings, when they are constructed, have Legionella in them already. And so the point I want to make here, in addition to talking about construction, is that more likely than not, you've been living side by side with Legionella with no ill effects for years. And as Brad said, the places where we potentially can be exposed to Legionella bacteria are innumerable. It can even be in your home, it can be in the hotel, it can be any place that has a warm water circulating system. And so that's just was a really important point to make, because it's not just old buildings, it's also new construction. And then we pay special attention when there's new construction, because some of the conditions around construction, like stagnation, pressure changes, and things like that, can cause brown water events that dislodge bacteria in our water systems, many bacteria, including Legionella. So we do want to pay attention when there's construction if Legionella is present. Next slide. So we've talked sort of about myth and fact. So this myth fact is, the myth is Legionella is everywhere. The fact is that it is not in every building. And depending on the study that we cite, between 12 and 70% of buildings can be positive for Legionella. And this is the reason why we test. We want to know, is Legionella there or not? Next slide, please. And so more specifically, this sort of breaks it down into different types of buildings. And so the studies that have been done on hospitals, depending on the study that we cite, anywhere from 12 to 70% of hospitals have been found to be positive for Legionella. Large high-rise buildings, up to 60% can have Legionella. Your own home. We did a study here in Pittsburgh because we knew about 60% of the hospitals were colonized. So we asked the question, well, what about single-family dwellings? And what we found in testing almost 300 homes, only about 6 to 10% had Legionella present. And so Legionella can be in your own home. It's a much simpler system, not as complex, and doesn't have hot water recirculation. And so that's part of the reason why we don't find it as much. And then cooling towers, not every cooling tower is positive for Legionella either. When we test for it, about 30 to 50% are positive for Legionella. So Legionella is not everywhere. Our rule of thumb is about half. About half of the buildings have Legionella and about half do not. And so the purpose of testing is to determine, are you in the half that have Legionella or in half that don't? If you're in the half that do, well, this is when water management practices can manage the risk of Legionella in our building water systems. Next slide. So those environmental conditions, we talked about, in people, Legionella has to be there, has to get into the lung, and has to be a susceptible person. Well, in the environment, there are also factors that have to come together in order for Legionella to grow within our building systems. And the most important one is probably temperature. So think of temperature around body temperature. Legionella finds ideal, so around 100 degrees. And then our water systems really have plenty of nutrients in them if Legionella is present to help it to grow. And I always, sort of think of the sediment and the scale in our pipes as like having more nooks and crannies than a Thomas's English muffin. So lots of opportunity for growth of bacteria in general. And then other microbes that are in our water system. So other bacteria, protozoa. And you're probably thinking, there's other bacteria, there's a protozoa in my water. Yeah. And again, we are exposed to that all the time with no ill effect. So these are the factors that come together to help Legionella to grow in our building water systems if it's present. Next slide. So I emphasize the warm water system because that's where these other bacteria, it's a nice sweet spot for growth. And so that's where the focus has been historically on Legionella prevention, is warm water systems. Now, not so much cold water systems. I don't worry about toilets and things like that. So this is a picture, obviously, of a hot tub. Well, does this infectious disease microbiologist that studied Legionella all my life get into hot tubs? No, not because of Legionella, but because of other bacteria like Pseudomonas that can cause rashes and things. So, I don't like to be a party pooper, but just think about that next time you get into a hot tub. Next slide. So just to wrap up my portion, again, GSA is taking just a wonderful step in evaluating the water systems of their buildings for the presence of Legionella, other bacteria and metals, and then doing a process, which Dr. Cullum's going to talk about here in a minute, called water management. And the analogy I always use is, think about a pot on the stove and the lid. The lid is water management practices, and the lid keeps growth under control. And as was said earlier, we're not going to completely eradicate Legionella from our water systems. It's a naturally occurring bacteria. But what we can do is keep the lid on the pot. We can keep the conditions that allow Legionella to grow unchecked under control through water management. And with that, I'm going to turn that over to Dr. Cullum to tell you what water management is.
Thank you, Dr. Stout. Yeah, you all can imagine, I'm sure this is a pretty tricky problem. How you keep that, that lid on the pot effectively. You have a very common entity, Legionella, that can cause disease, but exceedingly rarely. So how do you effectively tackle that without, boiling the ocean to try to stay dry at the beach? Well, this is something that an industry organization, the American Society of Heating, Refrigeration, Air Conditioning Engineers, ASHRAE, spent years thinking about and developed the standard ASHRAE standard 188, which was published in 2015 to try to tackle this issue. So this provides practices for water management to minimize the risk of legionellosis or Legionnaire's disease from a building water system. This is the backbone of how we do water management all over the US and other parts of the world. Basically, everything subsequent to this has sort of referenced this document to some degree and how we approach managing Legionella and water management. So this is the sort of philosophy that informs what GSA is doing. And I'll talk about, what's in this document and our perspective on it specifically. I do want to note though, that where this document and all the sort of subsequent regulations have applied have largely been in healthcare, because of the, focus on, compromised individuals, elderly individuals. There's been a lot of focus there. I want to read papers on whether or not a certain treatment works well for Legionella in water systems in one setting, or how common Legionella is. 90% of the papers are in healthcare or hospitals. A lot of the guidance is focused towards hospitals. A lot of the understanding is sort of in the context of healthcare and hospitals. I point that out for a couple of reasons. One is that our sort of understanding of this comes from a very conservative place, because again, a lot of this is informed by studies or understandings that come from healthcare and more vulnerable populations. Another, I just want to reemphasize sort of taking this approach, applying it at this scale in this context of more, office buildings or commercial buildings is a really big step forward in water quality, and I think just the historical through line of water quality. And you all are kind of at the forefront of that and having to acknowledge some of the microbial realities that everyone is experiencing. So, kudos to you all for that. So let me dive into this document a little more. Next slide, please. So what is involved in water management? What's described in that document is not fancy treatment technology or a filter. It is how you develop a document, a water management program that sort of organizes all of the energies and activities of people who understand Legionella and a building's water system into the actual management activities that are going to minimize the risk of Legionellosis. So what that includes: identification of responsible parties. Who all is going to have a hand on the ball? Typically, that's going to involve facilities. They understand the water system, administration, who can make decisions, move around money. It could be those with Legionella expertise, cultivated, through education like you all are experiencing right now. And in a hospital or healthcare setting, that might be infection prevention as well. So folks that understand the water system and understand Legionella have been sort of assembled in a team. Then you describe what exactly you're monitoring. So, how the water comes into the building, where it's treated, where it's heated, how it flows throughout the building. And then from there, you can sort of point out, based on scientific and industry guidance, where are the vulnerabilities for Legionella growth throughout this system. So example I like to use, you show that there's a water heater at some point in the system. Dr. Stout talked about tepid water temperatures can allow for Legionella growth. So if we're heating the water, we're at least introducing the possibility that we have these sort of tepid, lukewarm conditions. So that's the sort of hazard. Let's get a plan in place to control it. That is the operating goal and control limit. So we'll say for that water heater, we're going to specify that the water has to be heated to 140 degrees Fahrenheit. And then you go through the entire water system, do something similar with all of the potential vulnerabilities, get a plan in place to control, and then you monitor that control. So you specify where you're going to monitor, what water heaters, how frequently you're going to monitor the temperature there, how you're going to do it, who's going to do it. And while it's not required in ASHRAE 188, part of our philosophy is you always want to monitor for Legionella as well. The sort of idea being here, you can have the sort of best written, beautiful plan in the world, but it's a common bacteria. Water systems are complex, best laid plans of mice and men. You have to actually validate that what you are doing is working to control Legionella. And then finally, these plans describe corrective action. So what you're going to do if something is out of spec, be it the temperature of that water heater you've been monitoring, or you're finding Legionella in excess of levels that are desirable. Next slide, please. And I've described that as sort of a once through, but this really shouldn't be something that just gets written down, thrown in a filing cabinet. Again, it's about focusing the energy of knowledgeable people into the actual tasks that are going to manage Legionella, that are going to keep that lid on the pot. So you start with an understanding of the water system, you assess the risk with that understanding, put a plan in place to control that, and you monitor it. And then you use the data you get from that monitoring to sort of update your understanding. Legionella results, understanding of how the actual engineering of the water system is actually functioning, to sort of go back, update your understanding, update the risk and control measures you have in place. It's about focusing everyone's attention on this important issue. Next slide, please. All right. There was a lot of Legionella information in a short amount of time, so I'm going to try to hit the key points very quickly. Legionella. This is a genus of bacteria that can cause pneumonia, by and large in immunocompromised individuals. However, it is a very common bacteria, specifically in drinking water in the US and throughout the world. Roughly 50% of large building water systems we think contain Legionella. So it's important to identify. Proactive testing is the best way to define what needs to be done. And then you specify what exactly is done through an industry standard water management program. And this, again, does not eliminate Legionella, but the goal is to eliminate the risk of, or eliminate Legionnaire's disease, not the bacteria itself. And with that, I will hand it back off to, I think, Brad and GSA.
Yeah, thank you, Dr. Cullum, and thank you, Dr. Stout, for that informative presentation. It's really helpful to get that background and a little bit of additional insight. And I think Dr. Cullum always likes to say that you guys know more than 99% of the population by now about Legionella. So yeah, again, we appreciate you being here. And so now I'm going to dive into corrective actions a little bit and then pass it over to Jennifer at some point, and she'll kind of talk about specific regional actions. So next slide. Thank you. Appreciate it. So our first step in the process, as you can see from the infographic, is really to inform occupants of the situation. So our goal in these types of situations is to provide immediate notification within 24 hours, and then a more detailed follow-up notification within 3 business days that kind of outlines the plan of action for what's going to happen for that facility. And like we kind of talked about a little bit, but just to kind of reemphasize, some of those short-term actions that we typically first implement are flushing of the water system, and then we adjust those hot water temperatures. So we're aiming for certain temperatures within those hot water tanks, and then also at the point of use, at the delivery, we're shooting for certain temperatures, and there's kind of a differential in there. And at point of use, we balance that between where Legionella can grow, and then also anti-scalding regulation. So there's certain temperatures that we really can't go above either. So we kind of balance those two to make sure that we have proper protection, but also keeping people from getting burned as well. We'll do things like check disinfectant levels. So there's disinfectant that comes in from the drinking water treatment plant, and they add certain chemicals to provide protection through their system. And so what we can do is we can monitor those disinfectant levels that come out at the point of use and determine if, adequate flushing or usage is being happening at that individual fixture. And there might be some adjustments to that water management or that flushing program that needs to take place depending on what those results look like. After these steps, we will resample those individual outlets that tested elevated to ensure that those corrective actions have been effective. And as you can see from the image, this is often an iterative process where we might escalate the steps from there if those initial activities don't work. So there's some additional more aggressive steps that we can take as secondary or third tries if the initial does not solve the issue like we want. At this point, I will pass it over to Jennifer to talk through some additional information. Thank you.
Thank you, Brad. Next slide, please. So for Houston corrective action plans, and Brad touched on it and Dr. Stout, the question we had going into this sampling was not whether or not we would find Legionella. We knew we would. It was which of our buildings has Legionella and how much Legionella was in each facility. And that would give us an indication of how well the water was being managed at that facility and whether we needed to implement further water management strategies to control Legionella even further. We take each building individually. It's not a one size fits all. We have to look at the sample results. We look at where they were sampled. Where did we get positivity? How much positivity did we get? Was it limited to a specific system with a separate water heater? Is it limited to just a certain type of drinking water outlet as opposed to the entire facility system? So we look at each building and we take an approach of, we don't look at it as a whole. We have to, kind of slice and dice it. We've also partnered with SPL, and so we've had them look at our results, and we're kind of partnering for best response actions there, in addition to the industrial hygiene company that actually collected the samples for GSA. So that's a big partnering there. The first approach, the buildings will undergo extended flushing. As Brad kind of touched on, we're trying to get as much of that disinfectant into the building, get it to those outlets, and flush out any possible biofilm that might be present. And we're going to focus on areas where we did have zones of positivity. Any outlets with exceedances will then be resampled and to verify, did the flushing eradicate the Legionella into a well-controlled area. And if not, if resampling doesn't show that, we will go back and do some additional thermal disinfection, or we can do further chemical disinfection, which is called hyperchlorination, or copper silver ionization. So it can be a multi-step process as we try to figure out what best controls Legionella in these facilities. We will be also instituting an ASHRAE 188 water management plan in each of these facilities. And as Dr. Collum touched on, this plan will go further in depth of how do we keep Legionella well controlled in these facilities? Where are our weak spots? Where do we need to implement further steps to ensure that Legionella is controlled and will continue to be controlled in the future in all of our Houston facilities? Thank you. Next slide.
Okay, I think this is back to me. So before we do open it up to questions, and we're getting some great ones in the Q&A pod, I'm going to touch on some resources we've developed around the effort that are available to you and your employees and your counterparts. And I just want to point out that as this slide mentions, we're going to say proactive again. A proactive approach is important when it comes to water quality management. And as always, we're going to continue to be transparent and share all the information we have with you regarding testing schedules, results, and our corrective actions as Jennifer just went through. Next slide, please. So to that end, I wanted to call your attention to GSA's water quality website at www.gsa.gov/water quality. It's a great one-stop shop for an overview of the program, updates on the program, as well as a large trove of any additional water quality and safety resources that's provided by our partner agencies such as CDC, EPA, OSHA, and ASHRAE. We've also provided some links to, we provided a link to a blog format question and answer session that our Assistant Commissioner Courtney Springer conducted in January. That's just got some helpful Q&A in there, as well as some links to the client enrichment series sessions that we've performed on water quality. There was one in February, which was more of an overview of the session and what to expect. And then we just conducted one earlier in August. It's very similar information to what you've heard in the town hall, but goes into a little bit more detail about our communications and what to expect around that. That wraps it up. I'm going to, Brad started with a thank you. I'm going to close with a thank you. We want to continue to have this dialogue with you. I know that hearing about the presence of Legionella can be, it can be a little scary to everyone. So that's why we want to make sure that we're bringing the right people to the table and giving you an opportunity to ask us directly the things that are on your mind. So, this is a really big, critical, and pioneering effort. We are really looking forward to the results of that and how that will help us improve the health and safety of our facilities. And again, just thank you for being here today. So I'm going to turn it back over to Michael to kick off Q&A.
Thank you, Courtney. And now that we've entered the Q&A session, I know that Shayla's been monitoring the Q&A box, and I'm going to ask her if she would read off some of those questions, the most common questions that we've received to Dr. Stout and Dr. Cullum. Please note that we do have limited time, so if we don't get to the question that you've asked in our Q&A box, we will certainly answer those questions, and then we'll send those out in the near future.
Yes, so we have a lot of questions, and we have some that we had already received ahead of time, but I'm going to kind of consolidate a couple. One was, Legionella has been found in my building. Is the building safe to work in? And is the water safe to drink? So we'll start with that one.
Yeah, I'll start with that one. So during my comments, I mentioned that we're all likely been exposed to Legionella from some source without any ill effect. That includes the building that you're working in. Cases of Legionnaire's disease have not happened. And you kind of understand now, based on the steps that need to happen in order for disease to occur, why it's safe. And I used to say, when I worked at the Pittsburgh VA hospital, I would tell the patients, I drink the water, and I would have no trouble drinking the water in your building, because this is not an unsafe condition. As we've said, it's naturally occurring bacteria. It means that it's not uncommon to find it in our water. And so your building is safe. It is not an emergency situation.
Okay. GSA sample tested a sampling of the building. How can you be sure that other outlets aren't contaminated and don't need to be shut off?
You want to take that one, Dr. Cullum?
Yeah, so there has been a lot of people very interested for decades on how many samples you have to take to sort of adequately characterize the risk of Legionella within a building. Initially, the approach was, let's just sample everything. But we've sort of, or I guess experts in this area have sort of walked down the how many samples you need to take in order to adequately characterize the growth within a building. So what we understand now is that there are some rules you need to follow in order to adequately get a representative sample of samples within a building, but you do not have to sample every single outlet within a building in order to determine how much Legionella, or whether or not you have excessive growth of Legionella within a building. So from a risk characterization perspective, especially if this was something like a hospital where we were more concerned about infection, our concern would not necessarily be, individual outlets, but the number of outlets, what fraction of that representative sample was positive. So, briefly, we are characterizing risk sort of at a building level. So we don't have to sample every single outlet. And again, Legionella is finicky and it can be detected one day and not another. So that's why we like to characterize it on a building level. You don't necessarily have to pick out every single outlet.
Okay. Legionella was found in the main inlet to the building. How is this not contaminating the rest of the building water?
So I'll start and then we'll let the Dr. Cullum, the engineer, get a little bit more detail. When we're sampling in a building, we sample lots of different places, including what are called devices like cooling towers, hot water tanks, these expansion tanks. And as the microbiologist, I know that these devices have a unique environment, and that environment is different than what may be out in the distribution of the building water system. So I look at them separately, and for example, a hot water tank might have stratification within it that allows that sweet spot of temperature to exist for Legionella to be present. So microbiologically, they're different and don't contaminate the rest of the building. Legionella, as we talked about, is in small numbers, gets into our building and goes through the building, might land here, might land there, and only if the conditions are right for growth will it multiply. So you want to add some engineering to that, Dr. Cullum?
Well, I'll just say, from experience, and for those reasons, it's not unusual in our experience to see Legionella, within, I'll say, a water heater, and not within, most of or even all of the outlet or hot water outlets that are being served by that water heater for those reasons you're describing. And I can't speak to the, sampling here. Sometimes you run into a situation where in order to sample the incoming water, you use a valve that basically never gets used because, it's in the basement of the entry to the building. The water has been stagnant there for a very long time. That's not representative of the water that's actually, flowing past that sort of dead leg and into the building. So that can sometimes be why you might measure Legionella at an inlet and not other places within a building. But yeah, the complexity of buildings, the sort of necessity of all those factors Dr. Stout talked about in the presentation, the warm water, nutrients, other microbes, and stagnation, all of that needing to come together for that growth of Legionella is essentially why it can come into a building, but not to necessarily take hold everywhere.
Okay. Are toilets and restroom sinks safe to use? And I'm going to add this to it, but were kitchen sinks tested as well?
So the short answer is yes, they're safe to use. As I said in my presentation, I don't get concerned about toilets. It's cold water. Plus, in my lengthy career, I've never seen a report of Legionnaire's disease contracted from toilets. So sampling within a building typically is faucets that are used by building occupants or in hospitals will be patients. So that's part of the selection of location for sampling. Dr. Cullum, you want to add to that?
Yeah, I'll just say sometimes it comes up, toilets create aerosols. People like to point this out and suggest cover your toothbrush or something like that. And to some degree that is true, but reality is the amount of aerosols that toilets create is not that large compared to other activities or other devices like a decorative water fountain or a hot tub. So they can create out aerosols, but not that much in the grand scheme of things, and they use cold water exclusively. So we when we're evaluating these things, we're really not concerned about toilets as a source of exposure.
All right.
And I can chime in on the kitchen. I know that portion wasn't answered as someone had asked that. Yes, we did sample kitchenettes or kitchen faucets. We took an inventory of the kitchen faucets in each building, and we collected a representative number of samples from kitchenettes. So they were included in the scope of the sampling.
Thank you, Jennifer. Next question has to do with results. When can we get a copy of the final results?
I can also take that one, Shayla. With this initiative with GSA, we have really almost overtaxed the system. There are only a few laboratories in the United States that can actually culture Legionella in the specific way that GSA has outlined, that we have them sampled and analyzed. And so we have backed up these laboratories to the point where there is some delay with the sample results. We've gotten preliminary results from the industrial hygienist on several of our buildings. We've relayed those messages to tenant agency points of contact. We are still waiting on some additional results to come in so we can relay that final report. We had a meeting with them last week and emphasized the importance that we need this information. We need it for us. We also need it for our tenants so that we can inform everyone in our buildings. So we are putting pressure on them. We're hoping within the next week or so, we will have final reports that we can relay to everyone.
All right. Some of the bacteria dies with boiling water. If we have hot water from faucets, does the bacteria die? Or what is the maximum range of water that we can kill this bacteria?
You want to take that one, Dr. Cullum?
Yeah, so it will die extremely quickly in boiling water. I love very hot water coming from the faucet, but normally code, other parameters prevent you from being provided from water that's too hot. So normally, what CDC and others have recommended is that if water is heated, it's heated up to 140 degrees. And then if it's distributed around 120 degrees. Generally the hotter the water, the more likely or the quicker you are going to inactivate or kill Legionella. There are, again, some constraints in there because you don't want to scald people. So there's sort of a tension there that facilities have to deal with when they're tackling this. So when, different facilities are evaluating this, and as, buildings here are now, they're looking at water temperatures to sort of make sure that they're in good operating ranges. Yeah. So briefly, Legionella, there's no temperature at which it will be killed instantly, but the hotter the water, the more quickly it will either slow growing or die off.
Okay, the next question has to do with our timeline of the Houston buildings. So GSA is going to be performing additional flushing, cleaning, preventive maintenance on these outlets. What is the timeline I'm looking at getting drinkable water back in my building?
I can try and field that one. We have submitted response actions to our O&M. We are just waiting on a proposal for them so we can get the funds approved to pursue these. We're again pushing for sooner rather than later. We want to get these response actions done quickly so we can get the full building back to the tenants. In the interim, we have provided water dispensers. If there is an area that is lacking or we've missed, please reach out to your building manager and let them know. But there should be water dispensers available in any areas where we have removed multiple outlets.
Can I just tack on a little something there, if that's all right? So I think the words used in the question were, is my water drinkable? And the fancy term for that is potable. Your water is drinkable. The Environmental Protection Agency sets standards for potable water. Legionella is not one of the things that they set a defined limit at the point of use. They do have a target for at the municipal treatment plant, just like they do for eliminating fecal coliforms from our drinking water. But the fact that Legionella is present in water does not make it non-potable. It is water you can drink.
So the next question has to do with testing. How long after a test is done does it take for results to be known?
So that's
So-
a microbiological question, and it depends on the laboratory, believe it or not. And not all laboratories do the method that was referred to earlier in exactly the same way. And so in our laboratory, for example, typically we have final results by 14 days. Some other laboratories may take longer. So the answer of it depends is never very satisfying, but that's really the truth of the matter in this circumstance. Legionella is slow-growing bacteria. That's why it takes so long.
And here's kind of an additional one. How often is water tested in facilities, and where are current and past results posted?
So I can tackle that one. So this is actually something that is not required by code or regulation, and GSA is kind of taking this on as an initiative that we're doing, and we're kind of trying to be a leader within the industry of this. But this is the largest cross-sectional study that anyone has ever done on water quality. So we're kind of leading the effort, and we hope to kind of continue being leaders in this field and inspire others to follow. But this is not something that's done in the private industry or in government facilities. So this is kind of the first of its kind.
What steps is GSA taking to provide additional bottled water for drinking, hand sanitizers in the Houston buildings? And what action is GSA taking to test individuals in the buildings for Legionnaire's disease?
Well, I
Dr.
could tackle.
Do you want to cover when it is appropriate for someone maybe to get tested for Legionnaire's disease?
Sure. So as I said earlier, Legionnaire's disease is pneumonia. So that's the criteria for which you would test, have a physician do diagnostic testing on you, for example, and only then. The tests only detect the active infection or active pneumonia. So there's no testing of individuals to determine if they have Legionnaire's disease unless they have documented pneumonia.
Dr. Stout, do you want to touch on hand washing too? I noticed a lot of hand washing questions, and that was part of Shayla's question.
Sure. So Legionella doesn't survive on your hands. And I actually did studies of this when I was a graduate student way, way long ago. So, hand sanitizers and hand washing is for other bacteria that may be present on your hands, or, certainly when we're trying to prevent transmission of microbes that are transmitted person to person, whether it's on your hands or otherwise. Legionella is not transmitted when you have the disease. It is not transmitted person to person. So while I recommend hand washing just because it's a good idea for health, it's not necessary to control Legionella transmission.
And real quick, just to touch on that last part of that question was in regards to drinking water. And as Jennifer had noted, GSA, when we received these results, we identified in the interim, we brought in drinking water or bottled water until we could have water dispensers delivered to the locations where we needed water for our tenants. We placed those in common areas throughout our facilities. And if there is locations where you've identified that we don't have them in common areas where our tenants as well as our those visiting our locations, please reach out to our building managers and we can review that situation.
And we're about out of time for Q&A, but there's a couple of questions about whether slides will be shared or the recording. And yes, the recording will be shared, and we are working to make sure that all these questions are answered, and we are working on an FAQ document. So I just wanted to let everybody know that just because we don't get to everything right now, we are working on making sure that all these are addressed in later FAQ documents. So
Thank you, Shayla. And I also want to thank the panelists for joining us today. Thank you, Dr. Stout, Dr. Cullum, Courtney, and Brad, Jennifer, for your efforts, as well as Shayla and George and Lynette for this presentation. We hope that the information that was provided addresses some of your questions and your concerns, and we appreciate your attendance today to this town hall. Thank you.